Hi, it's Dr. Z. I'll be discussing the etiology of substance-related disorders today. By the end of this video, you'll be able to describe the biological and psychological perspectives related to the development of these disorders. Please feel free to pause the video at any time to take notes. Similar to anxiety disorders, there are two paths the psychologist can take when determining the potential cause of substance-related disorders. One path focuses on the biological perspective, and the other focuses on the psychological perspective. Each perspective can be separated into more specific causes. The biological perspective on abnormal behavior focuses on the role of genetics, family history, and neurobiology. The first specific biological cause is related to family and genetic studies. There appears to be both genetic and an environmental influence on the development of substance abuse. Twin studies on nicotine and illicit drug use support this conclusion. Additionally, whether a person starts using a substance may depend on environmental factors or triggers. The second biological cause is related to neurobiology. Brain imaging studies suggest that substances act on the reward systems of the brain. Neurotransmitters such as dopamine, serotonin, and GABA may all play a role in the development and maintenance of addictive behaviors. Additionally, the endogenous opioid system may have a reinforcing effect on the use of opiates and that of alcohol and nicotine. Now, let's turn to the psychological perspective. The psychological perspective on abnormal behavior arises from several different approaches, such as behavioral and cognitive. The first specific cause is related to behavioral theory. Recall that the behavioral perspective focuses on how abnormal behavior is a result of maladaptive learning processes. Operant conditioning, in its simplest form, is learning by consequences, or learning through reinforcement and punishment. Thus, operant conditioning can serve as a way for drugs to serve as reinforcers. Classical conditioning, in its simplest form, is learning by association. So classical conditioning can explain how environmental factors, such as when, where, and with whom the drug was used, can further maintain substance use. The film Trainspotting, shown here, is an example of a young man addicted to heroin and his struggle to become sober when surrounded by constant memories of his addicted life. The second specific cause is related to cognitive factors. Recall that the cognitive perspective views abnormal behavior as a result of distorted cognitions or distorted ways of thinking. Beck's cognitive theory explains how a person's interpretation of a situation may influence the decision to use the drug. Additionally, Bandura's social learning theory explains how biased belief systems about drugs can maintain substance abuse. Here in the film Cake, the character of Claire believes the only way to cope with her chronic pain is to abuse painkillers, and this goes to extreme lengths to maintain her addiction. The third specific cause is related to sociocultural factors. Recall that the sociocultural perspective views abnormal behavior as a reflection of the social and cultural environment in which a person lives. The importance of social, family, and environment factors cannot be denied. Research studies have revealed that family and peer influence, trauma, and economic factors tend to be associated with increased substance use and abuse. The film, A Clockwork Orange, describes the story of a gang of young adults under the influence of milk laced with narcotics, which then leads to a night of ultraviolence. In summary, there are two broad perspectives on the etiology of substance-related disorders, and each perspective is valuable in guiding the future treatment of your client. The photos used in this video are a property of the above-mentioned films. Thank you.